Now, let's talk about empathy. I think empathy is the key element in family and patient-centered care. In the previous video, I asked you to think about the negative aspects of responding with empathy to patients' concerns, feelings and needs. Did you think about it?
Thank you for your kind words and caring idea.
The answer is that if you do it without sincerity, the patient will sense it. No faking or lying here. Empathy must be genuine to create a positive interaction. Otherwise, the patient won't believe you. You may ask, can we become genuinely more empathetic? The answer is, yes, you can. Research has shown that empathy is not simply inborn, but can actually be learned. Empathy is not a static personality trait. It is a set of skills that can be improved or diminished based on circumstances. Additionally, just as there are many ways to feel, there are multiple ways to experience empathy. The three forms of empathy that psychologists have defined are emotional, cognitive, and behavioral, also known as compassionate empathy. Emotional empathy is the ability to share the feelings of another person. Some have described it as emotional contagion. This type of empathy helps you build emotional connections with others. Emotional contagion is having one person's emotions directly trigger similar emotions in other people. If you do this too often, you risk to find yourself on an emotional roller coaster. After a while you may burn out. Or to protect yourself, you may detach or feel numb, which is called compassionate fatigue.
Whatever. I won't let it bother me. I just don't care anymore.
Cognitive empathy is the ability to understand how a person feels and what they might be thinking. Cognitive empathy helps us relate to the other person by communicating understanding.
I understand. This is difficult and you are physically and emotionally exhausted.
Next, let's talk about the most amazing empathy. Behavioral empathy, also known as compassionate empathy. This empathy goes beyond simply understanding others and sharing their feelings. It actually moves us to take action, to help however we can.
Let me see what I can do to help.
I challenge you to think about what type of empathy you use the most. As we said, empathy is a complex suite of skills that builds upon itself. Next we will review skills that will help you respond and interact in an empathetic manner in difficult situations.